Hello everyone, my name is Tomonori Yano from National Cancer Center Hospital East, Kashiwa, Japan, and the chair of gastrointestinal endoscopy study group in the Japan Clinical Oncology Group. Today, together with my colleague Dr. Kadota, I would like to talk about our original article, which was recently accepted in GIE, and the title Long-Term Outcome after endoscopy resection for esophageal squamous cell carcinoma, invading the muscularis mucosa without lymphovascular invasion, a multicenter retrospective study. On behalf of co-authors, we would like to thank GIE for opportunity to present our study.
Hello everyone, my name is Tomohiro Kadota, first author of this article. It is a great honor to have an opportunity to introduce our study today.
First of all, why did you decide to conduct this study?
Endoscopic resection is now widely performed for esophageal squamous cell carcinoma. The pathological evaluation after a year can stratify the prognosis and determine the subsequent treatment strategy. PT1A EPLPM without LBI has very low risk of lymph node recurrence, so it was defined as a curative resection and followed up after a year is recommended. On the other hand, PT1A-M with LBI or PT1B-SM has high risk of lymph node recurrence, so it is defined as a non-curative resection and additional treatment such as surgery or chemoradiotherapy is recommended. In contrast, as for PT1A MMACC without LBI, metastasis rate was reported about 5% if followed up. Additional surgery and CRT were reported to have 1.3% of treatment-related deaths, and its efficacy was unknown. Since neither is clearly better, recommendation could not be determined for additional treatment in PT1A MM without LBI. Additionally, these recurrence data lacked robust data due to insufficient careful follow-up after a year and a small sample size. So this complicates interpretation.
From these backgrounds, what is the aim of this study?
We aimed to clarify the long-term outcome of patients with PT1A MMACC without LBI after a year based on careful follow-up. This multicenter retrospective observational study was conducted at 47 institutions participating in Jacob GIESG.
Jacob GIESG operates as a group that comprehensively handles clinical trials related to endoscopic diagnosis and treatment in the field of gastrointestinal cancer, primarily focusing on ESD within Japan. How did you set the target population and outcomes?
The key eligibility criteria for patients who underwent ER between 2008 and 2015, diagnosed as PT1A-MMACC without LBI and vertical margin negative and clinical N0M0. The endpoint was cumulative recurrence rate, CRR, recurrence-free survival, and overall survival. CRR was defined as the cumulative rate of patients with an event of lymph node metastasis and/or distant metastasis. These endpoints were retrospectively assessed according to the additional treatment.
How was the clinical courses after ESD, EMR, or PMM-ESCC without LVI?
A total of 540 patients were enrolled. Of these, 485 patients were observed and 45 were performed with CRT and 10 were performed with surgery. During the median follow-up of 7 years, 28 patients in observation group, 2 in CRT group and 1 in surgery group had recurrence, and 80 patients died from ESCC.
And how about the outcomes?
5-year CRR was 4.9% in observation group, 2.2% in CRT group, and 10% in surgery group. Although there was no significant difference, CRT shows lower CRR than observation. Similarly, there was no significant difference, but CRT had higher OS and RFS than observation.
And based on these results, how do you think about additional treatments for this population, necessary or not?
Despite a large sample size and long-term follow-up, CRR was 4.9%, consistent with prior reports. And additional CRT may be effective. However, its toxicity limits its use in all patients.
In this study, are there any other unique findings?
5 patients experienced recurrence more than 5 years after ER, suggesting that follow-up beyond 5 years is necessary. In addition, most recurrences were previously reported to be fatal. However, in this study, improved treatments enable salvage in some patients.
And what are the future implications of these findings?
Early detection of lymph node metastasis and risk stratification is crucial. Especially, shorter CT intervals and US may improve early detection. In addition, risk stratification is needed to identify high-risk patients.
So, in conclusion, based on results of this study, observation may be reasonable given the low recurrence risk. Acknowledging that recurrence remains possible, right?
Yes. Therefore, despite the low risk of metastasis, careful long follow-up is important. Thank you.